How can we ensure equitable distribution of health resources on a global scale? On the occasion of the 2024 Paris Peace Forum Spring Meeting, organized in Morocco on June 10th, in partnership with the University Mohammed VI Polytechnic, we invite you to discover a series of podcasts focusing on the shared North-South objective of fair transitions. The devastating consequences of pandemics, from the COVID-19 to repeated outbreaks of avian flu, Ebola and HIV, underscored the urgent need for early warning systems to detect and respond to emerging infectious diseases effectively. As the COVID-19 pandemic showed us, access to genetic sequence data is crucial to respond early to a health threat. While data being used to develop new medical products often comes from scientific institutions in the Global South, it does not always lead to compensation or access to medical countermeasures needed to fight a pandemic. A key element of the fair transitions is therefore to recognize the role of these institutions and to build strong foundations for the fair sharing of data and fair benefit from the proceeds of the use of such data. What is fair benefit sharing, and why is it important in global health, especially considering the likelihood of experiencing future pandemics? Why do we need to specifically compensate scientists to improve our pandemic preparedness? How could such a compensatory mechanism work? To address these questions, we've invited Spring Gombe, founding partner and chief strategist at Policy Strategy Group.
Well, I think the COVID-19 experience that we globally shared gives a good indication of why benefit sharing is important. Pandemics don't recognize borders. That is why they are pandemic, and bringing them under control requires a really high level of collaboration and solidarity among partners, both to find new tools that can be used as countermeasures for the pandemics, and to then distribute those tools to everybody who needs them in a really rapid fashion in order that the pandemic can be brought under control. If that doesn't happen, there will always be hotspots where the pandemic reoccurs. The very first step in preparing to respond to a pandemic is finding the tools that are needed. So that could be a drug or a vaccine. It'll certainly require diagnostics, both to tell us whether people are sick, infected or not, and also to tell us with what strain of a pathogen people might be infected with, in order that we give them the right treatment in the right dose at the right time. So the knowledge that goes into creating these new tools, that can be generated anywhere, as we saw in the case of the COVID pandemic, right? And much of the science, for example, that was done around identifying new variants of SARS coronavirus 2 was done in Africa. And much of that was done as a result of an earlier pandemic, the HIV pandemic, in which the spread was so rapid and the disease was so devastating that structures were set up and kept up in the period between, shall we say, the two pandemics, HIV and COVID-19. And the scientists who were working in this space continued to refine their expertise. Now, they were doing this without a lot of resources, either from the global community or from investments from their own governments. And it's a difficult space in which to work at the best of times. You're working with pathogens that could kill you, or that could give you a lifelong, life-changing infection. You're working with tools that are expensive to maintain. You have large teams of people that you need to involve in doing your research. You have a huge public that you need to involve in doing clinical trials. So all of these people, yourself included, are giving their bodies over to science. And so there should be some sort of recognition or compensation for giving their bodies over to science. And that is why it's important to share both the knowledge that helps us develop the perfect tool, and then the benefits, because everybody all over the world is contributing to the knowledge that was generated. And so it's not fair to say, right, you in South Africa, in Botswana, in Thailand, wherever, you contributed your bodies to science. The knowledge that we got from your bodies is being used to make a new therapeutic, but the company that's making it in Denmark or Sweden or the United States is going to reap all of the benefit for that. And not only do you not get the benefit of having access to the new tool as rapidly as it's available, maybe not even at all, but if and when you get that new tool, you have to pay more for it than somebody who's living in a country that has better infrastructure. So you're paying twice, if you like. You've given your body to science for free, quote unquote, and then you're also having to pay for the tool that was generated with the science that used your body. And for the scientists who are involved, I think, as you know, the way science is done, if you cannot show that the work that you're doing is useful to society, you often have to struggle to get funding, right? And so you spend years of your life investing in something that you know is important, but that you can't convey to the public it is important, and it isn't prioritized either at home by your governments giving money to research development or abroad by the recognition that you would get if you were in a place where that was acknowledged as important.
Why do we need to specifically compensate scientists to improve our pandemic preparedness?
The knowledge that we generate for creating pandemic countermeasures comes from science. That might be biomedical science, that might be material engineers, it might be physicists who have an insight into a particular aspect of pathogen, or it could be people who are involved in geographic information systems, tracking the way that, for example, catastrophes, climate-related catastrophes, might contribute to the spread of a pandemic. All of this work happens sort of underground, right? It's not recognized. But the way in which globally we finance science is, one, by setting priorities for scientific research, which are then afforded from the public sector grants, right? And grants are interest-free amounts of money that are given over to science because governments believe that it's for the benefit of society. Those are usually given nationally, right? Although in some cases, and in the case of the National Institutes of Health of the United States, they give grants all over the world to protect health because they recognize that pandemics can arise anywhere, etc. Nevertheless, that is money that arises from the public purse in a given country. The second way that we compensate science, and this is if scientists work in the private sector, is that if they produce something that results in mass profits for their employer, some of those profits are reinvested in providing them with the facilities to continue to do their work. Only if and only if scientists have the resources that they need to do their work are they free to explore all of the aspects of what might contribute to a pandemic or pathogen. And there's a lot of failure involved in science. You follow one idea, you think it might be the right idea. 2 years later, you find out, no, that's the wrong idea. The answer is not to say that should not have been invested in. It is to say, okay, we know it's not that. And that is very important for science. So when you invest in science, you have to compensate for loss as well as for any gains that are made. For a scientist following a particular career track, if the frustration of always having to chase after money takes over most of what they do, they will leave science. And if they leave science, all of the knowledge that they have generated is lost to humanity. And so there has to be a mechanism for saying, okay, we take a chance that the knowledge that these people are producing is going to be important and relevant for protecting humanity. We don't know how, we don't know when, but we're going to make those investments anyway. You saw the benefit of that in the emergence of mRNA vaccines, right? mRNA science had been done for 30 years before the relevance of it became clear in the COVID pandemic. If that science had not been done, COVID would have been much, much more devastating than it actually was. The fact that that science had been done and funded made it possible for us to have a tool very, very rapidly. And so we have to take that chance on the scientists of now for future pandemics. That is one thing that is very important. The second is that science is a major contributor to industrial development. So if we take something that is not pandemic related, but is in everyone's mind, if you look at the medicines or the technologies that have been developed for managing of obesity, they have been immensely profitable for the companies that have created them, but also for the societies in which they have been created. Why? Because these companies are often subject to what are called windfall taxes. This was also true in COVID. And those windfall taxes are then used to benefit education, building roads, building infrastructure, building climate sensitive, climate responsive infrastructures for us to live in and work in and move from place to place in. So there are indirect benefits from science to the industrial or the socio-economic development of a country. And that is also a reason why scientists should be compensated for working on improving pandemic preparedness.
How could such a compensatory mechanism work?
One of the things that you want to make sure you institute when you're trying to work on pandemic preparedness is what we call a state of readiness. You always have enough of a base to then switch things on or ramp things up when a pandemic comes into existence. You don't want to be building new infrastructure when the pandemic starts, because that's going to take time to build. And in that time, the disease of pandemic relevance will spread. So one of the things that we have been doing with the Paris Peace Forum is trying to explore if there are other domains that have instituted a mechanism that actually produces a state of readiness and retains a certain high level, a certain high standard to ensure that the quality of assets or resources that are coming out of that domain is always maintained at a high level. We looked in a number of places and found an unusual one that could provide some guidance, and that is the world of sport, and specifically the world of football. So in the world of football, which we all, now I'm talking about soccer for those of our audience who are non-European, African, Asian, or Australasian, so our American friends. So in the world of football, what happens is that every country, well, every little boy and now very many little girls around the world have a dream. And they have a dream that they will become the next Pelé, Messi, Ronaldo, you name it, these big stars who go on to make large amounts of money and play for the most prestigious clubs and win all kinds of trophies and medals. And the International Federation for Football Associations, FIFA, recognizes that in order for this stream of talent to be continually developed, they need to invest in football everywhere, because that talent can come out of anywhere. It might come out of Argentina, it might come out of Japan, it might come out of the United States, it might come out of South Africa. And so what they have done, and which we think global health can learn from, is they have instituted a mechanism which has two parts. The first is what is actually called the solidarity mechanism. And what that does is compensate clubs for training and developing young players who then transfer to other clubs. And the training clubs receive a share of the transfer fee. It applies when a player transfers between clubs in different countries before the end of the contract, so when they transfer. And it covers players between the ages of 12 and 23. And what is done is that a total of 5% of any transfer fee is set aside for the solidarity mechanism, and then it is distributed among the clubs where the player was registered during their training years. That is between ages 12 and 23. And that 5% is distributed as follows. Each year that a child was trained between the ages of 12 and 15 gets 0.25% of the transfer fee. And each year between the ages of 16 and 23, each year contributes 0.5% of the transfer fee, totaling the 5%. The second part of the mechanism is called the training compensation, and this ensures that clubs are rewarded for training players who sign their first professional contract. And this happens when a player signs the first contract or is transferred between clubs of different national associations between countries before the end of their contract. This only applies up until the age of 23, whereas the solidarity mechanism is lifelong or career long. The amount is compensated based upon the training and education costs incurred by the clubs that train the player, and it sets different costs for different categories of club depending on the country and level of the club, so that actually the clubs that have fewer resources are compensated in a way that is representative of that. So, for example, if a player was trained at a club for 3 years that had an annual training cost of 50,000 euros, that club would be entitled to 150,000 euros of compensation. And any disputes in both the solidarity mechanism and the training compensation are resolved by the dispute resolution chamber, which is managed by the FIFA clearinghouse. So FIFA takes over that responsibility, and it introduces sanctions that are very high for all clubs who are part of its system. So if you do not pay what is due to the club, and you do that through the FIFA clearinghouse, you're not allowed to participate in the transfer mechanism. So you're not allowed to compete for any of the players who might be talent from all over the world. What does that mean? You might not be the most competitive club in your top flight league. You might be relegated to the second league, etc. And in some cases, you are also, if you continue to violate, the penalties become stiffer. So you're not allowed to participate in the upper league. You're not allowed to participate in the World Cup. So the penalties are so stiff that from the richest club in the world to the poorest club, everybody plays by the rules. And that's very important for benefit sharing as well. Because if we all know that a country or a company can become very, very, very rich by making a new health technology that relies on the knowledge of other people and then relies on the contributions of other people and doesn't pay it back, two things will happen. Those who do the early science won't want to share the knowledge, which means that we will not have the technologies that we need. And those who do that last step before the new technology is created will also not want to tell anybody because they want to keep that benefit to themselves. And the result will be that we won't have access to the resources that we need to manage a pandemic. So we're trying to see how the principles and the practices that FIFA use in its solidarity mechanism can be translated to global health. And this issue is one of the major sticking points in the negotiation of the pandemic treaty. It's called the Pandemic Access and Benefits Sharing Clause or article, and really countries are fighting very hard over that. And we think that they can look to football for some of the answers. Will this mechanism translate 100%? We don't know. We're testing that idea. Will everybody play by the rules? Do we need a new court of arbitration of science? Maybe. We don't know. We're testing the idea. But we think that the idea does need testing exactly at this moment because the experience with the COVID pandemic has eroded trust in multilateralism and has eroded trust between institutions and countries of all sizes about pandemic sharing and even just sharing the news that there is a new disease, a new pathogen that might have broken out in some part of the world. So at the moment, we're very vulnerable and we're increasing the risk that a pandemic will spread because of the lack of trust. And so we're saying, look to the solidarity mechanism of FIFA, look to if we can't extract some ideas from there and all of the very clever people who still work there that we can apply to health. And we're hoping that the discussions on June 10th and going forward will contribute to that.
Thanks so much for listening, and please don't forget to check out the spring meeting sessions on the 10th June online on our YouTube channel, follow us on social media, and sign up to our email newsletter.